Dr. Butler.
All right. Well, thank you, Mr. Chairman, and good morning, members of the Senate Social Affairs Committee. I really appreciate the opportunity and the invitation to speak to you today. I am, for the audio record, Jay Butler, Chief Medical Officer of the Alaska Department of Health and Social Services, and also immediate past president of the U.S. Association of State and Territorial Health Officials. Although marijuana remains illegal at the federal level in the U.S., it has now been legalized in 9 states, and nearly 1 in 4 Americans live in a state where state law allows possession and retail sales. As the health official for a jurisdiction where possession and retail sale of marijuana was legalized in 2014, I'll focus my comments on 3 public health concerns regarding marijuana use and the public health approaches to mitigating those concerns. I'll be happy to discuss other issues related to the potential health risks as well as benefits during the question and answer period. The first public health concern is underage use, both intentional and unintentional. In Alaska in 2017, 41% of high school students reported ever trying marijuana, and 21% reported having used in the past month. 1 in 10 reported having used for the first time at age 13 or younger. However, over the past decade, these rates have changed little. Like Colorado, Alaska has been a state where historically use has been higher than national averages. However, there has also been an increase in the proportion of teens who believe that there are few or no health risks associated with marijuana use, and similar trends have also been reported from other states. Of concern is problem use and dependency, which is reported to develop in up to 1 in 10 regular users. And the risk of problem marijuana use is nearly 2-fold greater for those who initiate regular use during adolescence. In Alaska, as well as other states with open retail stores, sales as well as possession are restricted to persons aged 21 years and older. This aligns with the age restrictions in all states on alcohol sales, and now in 5 states and over 300 U.S. cities, sales of tobacco products. An increase in unintentional intoxication among young children was mentioned earlier due to ingestion of THC-infused edibles in Colorado. The problem is being addressed by requiring packaging and branding that clearly marks the item as containing tetrahydrocannabinol or THC, packaging that is unlikely to be attractive to children, child-resistant packaging, and limiting the amount of THC in a serving or in a single package. In Colorado, Washington, and California, the THC content in a serving is set at 10 milligrams. In Alaska and Oregon, it is 5 milligrams. In all 5 states, a single package cannot contain more than 10 servings. A second area of concern that was mentioned earlier is use during pregnancy. THC crosses the placenta and enters the fetal circulation. Animal studies suggest that exogenous cannabinoids may interfere with the action of the naturally occurring cannabinoids that contribute to normal fetal brain development. In humans, use during pregnancy has been linked to lower birth weight. A recent report from California demonstrated that use of marijuana during pregnancy, particularly among younger women, has increased, and roughly 1 in 5 pregnant women under age 24 reported having used marijuana in 2016 prior to legalization. Data from multiple states indicate declining perception of risk of use during pregnancy, although there have been few new data documenting either safety or risk. In Alaska, we've focused on providing information to pregnant women and their healthcare providers on the currently unknown safety profile of marijuana use during pregnancy. We've developed print and social media materials that address alcohol, tobacco, and marijuana use during pregnancy under the message of legal is not the same as safe. These materials are available through healthcare providers' offices, social service agencies, and marijuana retail outlets. And I've provided some of the printed forms of those materials, and I know they will be available to you later today. The third area of concern is driving under the influence. There's evidence that clear evidence that cannabis impairs driving and increases crash risk. Higher blood THC concentrations decrease reaction times, limit peripheral vision, increase variability in speed and lane position. Impairment by THC appears to be dose-related and is enhanced by concomitant use of alcohol. In Alaska, we're addressing driving and boating while impaired as part of a broader public health message, be a responsible user. This has included video broadcast and social messages developed by the Division of Public Health with input from community marijuana users and actually delivered by some of the retail store owners. And the reason for that is in doing community focus groups, we found that when it comes to marijuana use, users don't believe me, they don't believe their doctor, they don't believe the government in general, but they will listen to the retailers. It's important to note that there are a number of limitations in the data from the U.S. on the public health effects of marijuana legalization. First of all, there are only a few years of data available. Colorado and Washington legalized in 2012, followed by Alaska and Oregon in 2014, and it takes a number of months, if not years, for the commercialization and the retail regulation and establishment of a market to get up and going. So it's really too early to draw many firm conclusions. Second, although there are available data from earlier epidemiological studies, the retail marijuana that is available in 2018 generally has much higher THC content than what was available when many of us were young, as was mentioned earlier. Finally, there are many more modes of administration than in the past. In addition to the traditional joints and brownies, the emerging retail market includes THC-infused beverages, concentrate oils and tinctures, vaping solutions, topical products, in addition to a whole cornucopia of THC-infused products, everything from baked goods to salad dressing to barbecue sauce. Finally, I'll close by encouraging you to consider marijuana as a unique product. While there are public health lessons to be learned from the regulation of alcohol and tobacco, it's important to not conflate the health effects of those products or the optimal public health approach to each. I look forward to the discussion that will follow, and thank you for the opportunity to speak to you today.
Very much, Dr. Butler.